afternoon, everyone. Welcome to Sonographers in the Cities. I'm Lynn.
And I'm Giselle.
So I recently found out that you can rate our podcast on Spotify. And as of this episode, we have 17 of you who gave us 5 stars. So thank you so much for your reviews. This goes to the ones on Apple Podcasts as well, where we have, last time I checked, was 33. So our podcast is always growing, and we would not be where we are without your support. So thank you.
Whoa, that's so cool. I didn't even know that. I mean, I listened to our podcast actually on Apple Podcasts. So I had no idea that you could rate on Spotify. That's exciting.
I didn't know it until someone messaged me to link the Spotify link, because I've been doing Apple Podcasts link because that's the most of our listeners who use them. So now I try to do both. I don't know if you're doing it too, but that's how I found out we can rate our podcast on Spotify too.
Oh, that's awesome. Thank you guys for voting. I mean, that's still a lot of people for it just being new. And it's very exciting. And me and Lynn, before we got on, we're talking about how our podcast is growing and it's super exciting. Can't believe it's June. And thank you guys for listening. We're still getting people messaging us, which is awesome, letting us know that they are liking the podcast. We appreciate it. We really do have fun doing this. So thank you. We have actually the rest of the year kind of laid out for you guys. So that's also really cool too.
Until Ultrasound Awareness Month.
Yeah, so we have like our 1 year. So we're slowly coming up to 1 year. I mean, time went really fast. And I actually wanted to bring it up that I just a few days ago was talking to a patient. She's like in her like 70s or something like that. And she's so cute. We were like talking. I had to do a pleural effusion scan on her. And we were talking about age. And I was just like, yeah, age is just the number, like, and because you would never know that that's how old she was. And she was like, yeah, I know. And I asked her personally, I was like, so as you get older, does time go slower or faster? She said it goes faster. And I was like, oh my goodness. Because you would think as you get older, like maybe the days are slower. Maybe you're like waiting for the day to end, or I don't know. Or maybe you don't want it to end. I don't know. But she said it goes by fast. And I was like, is that why I feel like now time is flying by as I get older? Because I feel like time is just really going by so quickly. I don't know if you feel that way.
I do. I don't know if you feel it, but like throughout the week, I was like, oh, this week is so long. And then if I look back like a couple weeks ago, this week flew by, like last week flew by, the month flew by, this month flew by, the last 5 months flew by. It's just like, where did the time go? And in 6 months I'll be done with my program.
I know, look at you go.
That's so crazy.
I think it also, when I first started, it was about 2020. And then I remember like talking to all of you, and really a lot of the people who we were growing with in the very beginning, that I was growing with when I first started, like you guys are all graduating, getting your registries, like literally becoming sonographers. And I mean, because, most of the time these programs last from 2 to 4 years. So it's been really cool and an honor to see all of you guys growing, and look at you now. I mean, you guys comment below or tell us what you think. Like, does time move really fast for y'all? Because, I mean, it's just crazy seeing all of you guys. And like, you're going to graduate soon.
Yes, definitely. Let us know, comment below, message us. I don't know, let us know if time is going by fast for you, because it is going for us.
Well, I mean, today we're going to talk about our clinical experience, and Lynn is still currently in her clinicals, and she's got lots of experience behind her now. And I mean, that was what, 2016 for me. It's been 6 years. Yeah, it's been a while. So we'll start with you and your experience, and you're, currently living it, and we can hopefully help you guys who aren't in clinicals yet and are still kind of trying to figure out if you want to do ultrasound, or those of you who are scared to go to clinicals. Yeah, we'll definitely enlighten you on the truth behind our clinical experience. Now, remember, everyone's clinical experience is going to be different, especially if you're in echo, vascular, or general. Luckily, you guys got Lynn here who's doing vascular and echo, and I've got the general side for you guys. But yeah, before we
Yeah.
dived into that, did you want to say anything?
My clinical experience.
Yeah.
I mean, like we covered quite a bit last month,
Mm-hmm.
with a lot of our clinical topics. But I definitely, the biggest thought I had recently, because my friend, Christy, and I was saying how I'm I'm liking vascular more because of my clinical experience, and she's liking echo more because of her clinical experience. And I came to the conclusion that clinical experience really affects where you want to work at the end of your program, because that like totally changed your life, because you're going to be working, and I could be doing vascular for the next 10 years of my life, and she could be doing echo for the next 10 years of her life. Like
Mm-hmm.
nothing's going to change your mind, because for me, my clinical experience has been like really, really great with vascular, and then echo is just like, oh my goodness. And I can't really say much because I'm currently in it, but I can only say I like to be transparent with you that I'm in outpatient private practice for echo, and it is tough.
That's a good word. That's a good way to
Yeah.
put it,
It's
Well,
yeah,
is it
it's like
tough
I'm learning
because
that. It's like it's more of like I'm learning what I don't like, which is
yeah.
really, really good for me, because I can come out of this knowing what I want and what I'm looking for in my job opportunities.
Mm-hmm. I like that though, because how would you know? How would you have known if you liked it or not without having that experience?
Mm-hmm.
You know? And also that kind of relays back to the people who go into sonography thinking they're going to do scans of just babies, and people go into it thinking like, oh my gosh, I love babies, so I'm gonna scan babies. And then people who go into it realize they don't like scanning the babies, the babies in the bellies, that is, because we can also scan pediatrics, which is, babies after they're born, so neonates. And you don't even realize how much stuff is in ultrasound, like until you go to clinicals. Even with just echo and vascular, like just those subspecialties by themselves, it's a lot of pathology, a lot of anatomy, a lot of things you guys need to know, especially even with the machines. Like people think the machines just take the pictures. It's really not just that. We, the people, the human beings behind the machine, are using our brains and all of our knowledge to get that great image for the radiologist. So I've still been getting a lot of comments and messages asking if ultrasound is easy. So what do you have to say to them?
It's not easy. It requires a lot of critical thinking. Like try like when you're talking about obtaining a great image, there's a lot of process that goes into it, and that's the SBI part.
Mm-hmm.
And it's just, when you ask like what's the couple of words or characteristics to describe sonographers or ultrasound, a lot of you said investigators, and that's what you actually do. You have to kind of investigate how to get this image, how to maneuver the probe, how to adjust the machine so that you can get this pathology, or you can get the image to rule out the pathology. I think that's not easy.
Mm-hmm. Especially with a moving target, especially with someone who's breathing, who's in pain, somebody who may be on a ventilator, someone who may be combative or, frustrated or doesn't want the exam. There's so many other variables that people don't realize.
Oh yes.
And when you do, though, it's because your clinical experience, you worked in a hospital setting or you worked in an outpatient setting. And that's why the clinical experience is so important for people. And just like Lynn said, you have to kind of see what you like and what you don't like. Now, my clinical experience was only in a hospital setting. I never got to go to an outpatient setting. And so I only saw hospital. So I can only imagine what people can do and decide after they have rotations, because a lot of you guys have rotating clinical sites where you go to outpatient, you go to OB, you go to a lab, or you go to a hospital. Like that's really nice to have. So like with your experience, do you feel like how what kind of advice do you think that people should take going into their clinical experience, knowing what you know now since you're already in it?
I would say just keep an open mind. Even if you don't like it, you're learning something.
Yeah.
That's what I'm doing literally right now.
Yeah, and like even though you might not like something or you might not want to scan something, go in there and scan it. So you know and you've seen it, and that'll help you be a better sonographer at the end of the
Mhm.
day. It'll help you choose your choices at the end of the day and decide how to be a sonographer. Like being a sonographer is more than just taking the images. It's also patient care, and it's also being organized, multitasking, having to deal with so many things at one time. And I don't know, I love it because it's a challenge. It's very demanding. You need to have a lot of skills to be a sonographer. And where do you get these skills from?
Clinicals.
Yeah. So, like use clinicals as a way to realize, hey, you're going to be doing that for the rest of your life. If that's the career you decided and this is what you want to do, like that's what you're going to be doing for a long time. And yeah, there are ways you can move up in the field, right? But clinical is the first place and the only place where you're going to learn how to become a better sonographer, how to scan better. It's not going to be in lab. It's not going to be in school. It's going to be in clinical. So I don't know if you can like touch upon what you've done as a student in your clinical setting. Like, what are some things that you do while you're in clinicals?
Well, as a student, my first thing was, help my preceptor or whoever I was following, because they're spending their time teaching me. So the least I could do is, like refill the linens or cleaning up the rooms after the patients leave, or just make their like those little tasks, do it for them so that they can focus something else, like writing reports or their emails, just a little, making their life a little bit easier, since you're attached to them for the day. And another thing I like to do is ask questions. I ask, why is it like this? Or what are we seeing? What's going on? Just so that I can like think, like if I were alone, it's like how would I, I'm not gonna have a experienced sonographer there to ask questions like what am I seeing, because once I'm alone, I'm a sonographer, uh, it's all on me. So clinicals is like the time where I can ask questions, dumb questions, you know as many questions as I want, and just to get all that knowledge so that I can be proficient
Mm-hmm.
once I'm done. And then another thing is just learn. I'm learning to work as a team in a medical environment, since I didn't have a medical background. But
Mm-hmm.
then teamwork, and working with others, that goes along with any kind of job. Team, was it team work, team building?
Mm-hmm.
But it's just like any workplace environment. So those are like and professionalism, because it is a workplace. And not to mention patient care.
Mm-hmm.
That's a big part. As a student, a lot of patients are hesitant about students, and so you guess those picky ones, like I want someone experienced to scan me.
Mm-hmm.
Or you get the sweet one. It's like, everybody gotta learn somewhere.
Yeah.
So you get to experience a wide array of things, from patients to workplace environment to sonography. And there's no other place you learn that than clinicals.
Yep. Just being thrown into the action, really. Because,
Mm-hmm.
yes, while you're in lab at school and you're learning how to scan, you're not going to learn your skills until you have real patients who are having, stuff going on with them. You're not going to have build skills without that kind of challenge in front of you. People who have a lot of bowel gas, people who ate food, because when I was in lab, we weren't eating food because they tell you to be NPO so that you can see all the organs. NPO meaning not eating any food or drinking anything so that you can see better. And that's why we do that for patients, because we want, for outpatient at least, because they want you to be able to see the organs. But in the hospital setting, people come in there with a lot of bowel gas all the time because, they're coming into the ER. They probably ate a sandwich before they came in and now they're having abdominal pain. Like that happens all the time. And now you're scanning all this gas. But then let's say you went to somewhere where you never got to scan gas. How are you going to understand how to maneuver the patient with gas and try to figure out how to find the pancreas or the kidneys and the liver and get that gas out of the way, right? You learn that from clinical. So we had an episode on episode 29 where we spoke about how to prepare for clinicals. And so hopefully if you guys want to figure out how to prepare, like that's the episode for you. But today I wanted to just kind of share a little bit how my experience went because I haven't talked about that yet. I don't know. I just want to paint a little picture for those of you who are curious about how clinicals are. And then maybe Lynn can see if hers was a little bit same, like the same or different, because like every clinical setting is going to be different. And you'll hear when some people have the issue where they don't like their clinical site. I actually really enjoyed my clinical site. And like we said in our previous episode, we say that it's usually like a long interview if you're at that clinical site, because maybe they'll want you to work for them, right? So use that wisely. But I remember being so nervous for my clinicals that I was like, I'm not ready, not prepared. I really went in there not really knowing much except for how to do some protocols. And even then, I still felt really lost. But my first day, basically what they did was they showed me around the department. They showed me how the schedule works. They showed me the whole hospital. Like they gave me a tour and everything like that. And this place, I was there my whole entire clinical. So I was there from like June 2016 till May 2017 when I graduated. So I was there for a very long period of time. And I followed the supervisor around. So he would basically have me learn procedures first. So I don't know if you guys know, but in general sonography, we do procedures where we like drain fluid from the belly, drain fluid from around the chest. And these are all things I had no idea about, right? Like, because you don't do that in lab, And I was like, whoa, what are we doing here? So they kind of got me used to talking to patients like that because you spend almost 30 minutes to an hour with these patients. So I learned everything like patient care, how to speak to a patient with doing these procedures. And after learning procedures, being comfortable with the probe, they pushed me on to doing vascular studies, carotids. So I did carotids, which I did not learn in lab, mind you. I learned everything about carotids in clinical. They taught me how to do it. They taught me the protocol and I learned that. And what they did was make sure that I learned how to do carotids because what do you know carotids, like it's such minimal movement on the neck. Like you have to really hold that probe still. You really have to finesse it really well, the angles. You have to use the machine a lot, right? You have to like move the box, push the Doppler. The amount of things you have to do for a carotid ultrasound is crazy. They taught me that first and I got really comfortable with having to use the machine, hold the probe. Next up, they let me scan vascular like veins and arteries. And I was doing that for a few weeks. Like I wasn't doing this till a few months later. So maybe like 2 or 3 months. And then after that, then they had me scanning renals. Then they had me scanning abdomens. So they were kind of like just kind of introducing me to stuff and then learning how to get angles and things like that. Once I perfected that, they let me scan those things like basically on my own and they would kind of watch me, but then at a point they would kind of just be like, they trust me because of how much I was learning and picking things up. Isn't that crazy to know that even just after a few weeks scanning over and over and over again, like you just pick up the skills and that's how I learned everything, just by practicing and scanning. I went in there from knowing nothing to like basically being able to do a full-on carotid by myself in like 20 minutes. And now I can do a full carotid in like 10 minutes. Obviously, if it's a normal carotid. But it's just crazy to know that at one point I went in there knowing nothing, and then that's what the point of clinical is they're supposed to teach you. And I only had one or two preceptors. Some people will have multiple preceptors. I don't know how many you have, but for my experience is that once I had to shift away from those two preceptors, I was like, whoa, these people are teaching me a little bit different, or like they're saying a little bit more different things. And I was like, oh my gosh, so she said something or he said something, and that's different than what they said and they taught me. I'm like, what is going on here? But that's where I learned that everyone was taught differently. Everyone has a different way of scanning things. And even though everyone has a different way of scanning things, at the end of the day, if you all come up with the same results, that's what matters. So if Lynn scans a carotid and I scan a carotid, she may have a different protocol or a different way she's doing it. I should still be able to get the same results that she's getting as far as velocities go. The protocol should be pretty similar, I think, but she's taught probably way differently than I was taught over here. And at the end of the day, though, we should be able to say, like, oh, is there stenosis in the ICA? Like, oh, is there plaque in the carotid? Like, things like that. But I learned so much from my clinical experience that, I mean, I think it's the most important part of anyone becoming a really good sonographer. And it was very challenging. I mean, I remember the amount of days where I was like so stressed out, and I'm like, I don't know if I'm getting the right image. I don't know if I'm getting, what the doctor wants, but that's what your preceptors are for. And they were able to help me understand what I needed. And I asked them questions just like Lynn said. So I believe that, like, if you're really willing to learn, your clinical experience is going to be really good, regardless of who's like teaching you and things like that, because you're going to be the one that's saying, hey, I want to know this, I want to learn, or teach me everything that you know. And I think if you're going into clinicals, like, definitely be open to scanning anything, because by the time I was done learning stuff and pretty much in general, like, knowing everything I need to know to become a sonographer by February. So that's June, July, August, September, November, like 8 months. What is that? 8 months, 7, 8 months. Yeah. So just in like 7, 8 months, I was pretty much prepared to get a job, got a job as a student. That's what's possible if you're really, really, focus on learning everything that you can and being the best student in clinical that you can be, because these people are probably willing to hire you if you're giving them a good, like if you're impressing them, right? And like for Lynn, hearing that you were doing, the little things for your preceptors, like filling linen and helping them with things like that, already shows that she's going to be a great sonographer, because she's putting that effort in. And I would want to hire you because you're helping me while I'm also trying to teach you. Like, that's just the ultimate, like, yeah. And so that's a good way to, like, good thing to take into your clinical experience. But I learned from two people solely the majority of my clinicals. Did you have multiple preceptors at like the places that you've been to?
So that was an awesome clinical story. I've heard bits and pieces, but this is the first time that I heard like the full on about it, and it sounds like you had so much fun. Not only did you learn a lot, I could hear that you had so much fun learning and being there. So
that's fun. I know, saw so many pathologies that I never thought I'd see before. And like just seeing all that really helped me, I think, shape me today.
Yes, and when you were saying it, I kept thinking, going back to one of my clinical sites, which is the hospital. And to be honest, when I was like in my clearance or to get to be allowed into the hospital, like I didn't even have orientation. Like I had nowhere to go. I even emailed my preceptors, like, please let me know, if I need to know anything. She didn't respond. I was like, I don't know where I'm going. The first day I got there, I went to their old location 7 years ago because the security guy directed me there.
Wow. Oh my gosh.
Yeah, so I was so lost. I got there late And then when I got there, I saw my preceptor and she was like, "Oh yeah, you got here. Good job." I was like, "This place is a maze."
Probably really big.
And they didn't walk me through like, oh, these are our lab, how everything works. I had to ask for like, so how does this work? Because this lab has an inpatient and outpatient, and different days I was an inpatient and I was an outpatient. So I had to ask like, what am I expected to do? And what can I expect from them? Because I had no idea. No one told me anything.
Mm-hmm.
And slowly, I just learned through how the operations are at this lab. And I thought I was supposed to follow one person for my entire clinicals, but no, they're just like you follow whoever.
Mm-hmm.
And it's my first clinical, and I was so shy and nervous, and I didn't speak to anyone. I didn't know anyone. I'm just like sitting in the
Aw.
dark corner. And I was like, I'm gonna study because
Aw.
everyone seemed busy and it's always so hectic.
Right.
And and I was like, okay, I have to like get up the nerve and ask someone so I can like actually see. And my face was so red. I was like, excuse me, can I follow you to a exam?
Aw.
And they're like,
What?
oh yeah, of course. I
Aw.
was like, can I help bring a patient? And I didn't know how to bring a patient in.
Uh-huh.
I didn't know any of that.
Yeah.
So
But look
they
at you
showed
took the
me how.
initiative.
You can see
Yeah.
how like I was ready because
You did.
I can still remember how scared I was. I was like, oh my gosh, a real patient, and I'm like, they're alive.
That's so funny.
But yeah, I mean that's how I learned, and there are 9 of them, and I was so
Mm.
very overwhelmed. It's like, who do I ask? Everyone's so busy, and like in
Yeah.
their own, they all had their own computers, they all had their stuff to do. It's like,
Wow. Mm-hmm.
but you gotta take initiative, and I
Yeah.
learned that the hard way.
Well,
And ask like, how can I help? I think that really
yeah.
helps a lot. And I'm
There you
like,
go.
can I help with linens? Can I help clean rooms? Just like
Mm-hmm.
anything, like.
Yeah.
And they were so nice, like, since I was willing to help, that they're like, oh, if you need time to study, if you have like a quiz or a test the next day, you can take some time. You don't have to follow me to another exam or set up linens and stuff.
Mm-hmm.
So that was like, it's a give and take. And
Yeah.
I think that's a very good experience that I had at my site. A little bit different from yours because you
Yeah.
followed 2, right? I
Yeah.
followed
You
9.
follow 9. No, that's like actually, but that's good that you share that too, because I want people to see that there is a big gap, big difference of wherever you go. I mean, I'm sure you get people who ask you questions all the time about or need advice for their clinical site. I mean, I've had people say they didn't like their site or someone's not helping them or they're not teaching them. Like when you get the unfortunate sites where it's very difficult to get scans, because we want to remind you guys too that like we don't, these clinical sites, like they're working, they're doing their job, they're trying to get through their patients. Having a student is also very hard on top of the duties that they already have. So if you're not a student that's willing to help, willing to work, willing to ask questions like Lynn, they're probably not going to give you the time of day. Just like if I had somebody who just like, just sat there and didn't really ask me or do anything, like I'm only going to give you as much energy as you want to receive from me, right? So if you really want, take the initiative, ask the questions, just like Lynn, like you did it perfectly. Like that's
Oh, thank
exactly what
you.
you should have done in that situation, especially if no one's telling you what to do or talking to you,
I mean, in my mind, I was like, if I'm a sonographer, what would I want my students to do?
Mm-hmm.
Or what
Yeah.
would I expect my students to do?
Right.
So that was my thought going into clinicals every day. I was like, how can I
That's
be
a
the
good thought.
student that I want to have
Mm-hmm.
when I'm busy and all that, stressed.
Yeah. Yeah.
Another
And
thing with like clinicals that I learned, which is a crazy thing, is like, have you ever seen someone do carotids with patients in a wheelchair?
mm-hmm.
And it was the first time because it was like in the book it says the patient has to be supine.
Yeah.
And it amazes me how creative sonographers can get
Yeah.
in a situation that they're in, because in this instance, I will always remember it was a really hectic morning, and the nurses and the transporters of the hospital weren't communicating, they're not listening, and patients weren't brought down in a stretcher. He was in a wheelchair and they had to wheel him straight to the OR, but they needed the carotids. And I'm just like, usually they have to be supine.
Mm-hmm.
But the sonographer just like, screw it, I'm gonna do this so that we can get on to the next patient. And she did the carotid
Real quick.
patient sitting like this
Mm-hmm. Yeah.
within 30 minutes.
Yeah.
And I'm just like,
I do remember the
it's
first time I
really
did that.
amazing.
Yeah, those are situations that you only learn if they happen, right? Because what if you were like in a situation and you didn't know what to do? I mean, there's going to be lots of situations as a sonographer, you're not going to know what to do, but you have to come up with something
Mm-hmm.
and figure out how to do it, especially like patients in a wheelchair who can't get up from the ER and get into your bed. I'll scan them in the wheelchair and, that's what I have to do. Obviously, I've learned that some from clinicals because there have been many times where I had to just scan a patient in a chair. And sometimes there's just things that you have to do and have to learn and go through. And I think clinical is the greatest place to learn all that. And ask your preceptors, like, what do you do in this situation? How do I
Mm-hmm.
accomplish this? You know, do your job, but figure out how to do it the right way. And I mean, there's a lot of ways you can do it. You got to think outside the box. It's not just like a one set, like, oh, the textbook's going to teach me how to do this. No, you have to actually go out there and learn and have those situations happen to you. So
Yeah,
that's a
exactly.
good
I
example.
totally agree because now, like, if I'm, when I'm done and I'm working, if I haven't witnessed that in real life at clinicals, I would not have thought of doing that if I were to be in that exact same position,
Mm-hmm.
you know? So that's like something that is very impressive in my mind. And
Yeah.
obviously, I remember it all the time because I'm sharing it right now. But I have a
Yeah.
question for you.
Mm-hmm.
Since you have so much fun at your clinical experience and you loved it there, what was the most like challenging, if you can remember, moment or aspect of it that you were just like, you felt really demotivated and it was like, I don't know if like I want
Yeah.
to go back the next day, or sometimes you're just like, I need a
Mm-hmm.
break,
Yeah.
Do you have any of those moments?
Well, I was so like my mindset was so like, I just got to get through clinical so that I can get a job. Like that was one of the things. Actually, but the weirdest thing is that I'm not very like I'm a very emotional person, but if I looked back at the clinical setting, I never really got like upset about many things except for this one period of time where I was doing a bunch of procedures in a row. And let me tell you, when you do a thoracentesis to remove fluid from the chest, that's the doctor who's doing it. The radiologist is the one that's performing, like actually performing everything. But there was a week where I had like 4 or 5 patients have pneumos. And so that's something that's like that's a what is it? It's like that happens if something like a mistake or something possibly like happens in the procedure where they accidentally like either got air in the tube or they could potentially nick the lung. Like that's something that could possibly be bad from the procedure. And I had 5 patients as a student who had that in that week. And I'll tell you, a lot of techs have never seen that before. Like has never had a pneumo following a thoracentesis. So that week was very stressful for me. They had to do an investigation. I was the one that was helping, assisting the doctors, and there were different doctors. It wasn't like the same doctor over and over and over again. So during that time, I was really questioning, like, dude, what am I doing wrong? Like, oh my God, like it was so stressful. That was the only thing that really made me cry during clinical.
Oh.
I know it was crazy because like you would think other things, like just learning how to scan, like difficult patients, like yeah, it's stressful, but I knew that that was helping me become better. Like I knew all the hard and challenging things were making me better, and I was like, okay. Like I can remember and recall all the hard scans I had, like all the hard arms I had where I couldn't see the cephalic, or the legs where I like couldn't see anything. Like those situations, they really kind of shape you because you want to get the best images. You want to do the best for the patient. But yeah, that week was so crazy. I was like, dude, am I doing something wrong? So it's just weird that that was the only thing. But I had to like deal with that and kind of figure out like, okay, it wasn't my fault. Like none of that is my fault because I'm just assisting the radiologist. But there's nothing I could have done to prevent that from happening. Because that's the one of the risks they tell the patients when they do the procedures is like you could potentially have a pneumo from the procedure. And I had 5 of them in that 1 week. A lot of people who've done ultrasound for like 10, 15 years will say they've never seen one happen. So I was like really shocked. And that was hard to take in. I was questioning myself and that had nothing to do with me, you know?
Mm-hmm.
But I mean, clinical it's hard and challenging in general. I think all the stress and stuff came to me after I started working because in the clinical mindset, I knew that I was still learning. So I was trying to not be so hard on myself. And that's what my preceptor told me all the time. Like they were very hard on me, but also told me like, you're still learning. Like if you make that mistake, learn from it and then don't do it again. I think I was really lucky to have really great preceptors and a great site. So I wish that for everyone. That's
I
what I
do
want
too.
for everyone. It's not supposed to, I mean, it's going to be stressful, but it's like that's supposed to help you become better,
Good stress.
Yeah.
It
So,
pushes you to be better.
and I would rather have somebody have all that stress. I'd rather give you all the hard, difficult stuff because I need you to learn how to do that. Because if you don't learn how to do that, how are you going to do that on your own? Like I had to do renal artery stenosis studies. Like I was scanning these patients for like hours, like an hour, hour and a half. And I did a lot of them, or even like reflux studies. Like I had to do a bunch of those too. And those are hard, but I did them. And even though they were hard and stressful, I'm capable of doing them now. And I'm like, oh, I can do them. Like, give me a reflux study, give me a renal artery stenosis. Like, I'll do it. But I would not be that comfortable if I didn't do them in clinical. And just like, for example, Leah, right now, she's learning all her MFM stuff. And I don't know if you've seen her post. So if you guys haven't followed her, but she talks about how she's learning, like she knew how to do the scan, but she knew how to do them quickly. She didn't know how to do them like slow down and like get the correct images and things like that. And that's what she's learning right now. And that's what you should get from clinicals, like how to get the right image and take your time. That's something you can't really get at an outpatient place, honestly. You have
No.
to be at a hospital to do that. Outpatients are like go 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 go, and at hospital you kind of have a little bit more time to spend with the patient. So definitely I recommend hospitals to learn.
So far, yes, I totally agree. Because that's where you learn pathologies and you learn, the hard stuff about it. And then outpatient, that's where you already honed in those skills and you can just work on your speed. That's what I've been doing. So
Yeah.
I think that's why I've learned. And yeah, it's like clinical experience.
Yeah.
They make or break you.
Yep, they really do. They really do. But they shape you. They shape you at the end of the
Definitely.
day. So I know it's a very long episode, but we hope that it's very helpful. We could talk about our clinical experience all day. If you guys want more, just let us know.
Yes,
And
I
we
can
can
tell
tell you.
more
Yeah.
once I'm done. I'm
Yeah.
done
We're
with the
waiting for her.
program. I'm done with my program. I can tell you all the deeds, like transparent.
Yeah. Yeah. Once you're a sonographer and you got your job. But right now, you guys, she's still in it. So just know that your clinical experience might be different than somebody else's. You might be in the same cohort, but you might have a different experience. And that is just because of the place you're at. So, talk to one of us, talk to anyone, see how it is, and, get some advice because every experience is different. But yeah, hopefully this gave you some insight.
And if you want someone to talk to about, their own clinical experience, just our Discord community is a great community with so many members in the US and out of the US.
Yeah, out of the country
So
too.
if you are curious, have questions, send Giselle a DM. I know I've been sending a couple your way.
Yeah. Yeah, we got a lot of new members actually. We're
So-
getting close to 700. And my Facebook group also just hit 1,000 members. So yay, Thanks, guys.
Congrats.
Lots
We're a
of
big
yeah.
small community.
Yeah, big small community. We have a lot of things. Like, we're here to help you guys. So if you really do need help, message us and we'll get you to the right place. So thank you guys for listening.
Yes, thank you so much for listening, and can't wait to talk to you more for the next episode.
Yes, we'll see you